So if someone comes in with a tooth abscess, it's usually someone who's in pain. You can also have a tooth abscess without pain, and that's something that's only noticed on an x-ray. So if you went to see your dentist and he took some x-rays, he or she took some x-rays, and they noticed that you have an area of infection or an area that they think is infection on an x-ray, they might send you to a surgeon to have it evaluated. But that usually doesn't cause you pain unless that's what you came to the dentist for. If you wake up in the morning and you have pain in your jaw, most likely you have a tooth infection. And that needs the attention of a dentist and sometimes the attention of someone like myself who's an oral surgeon. First of all, you need to come into the office and we need to take an x-ray, if you don't have one already, of the area that's in question. Sometimes you might have swelling in the area, and the swelling can be just swelling in the gum above or underneath your tooth, or some parts of your face may get swollen. Some patients come in with a swelling in their cheek. Sometimes the swelling can come close to the eye. Sometimes they can have a swelling in their neck. And that depends on which tooth is involved and how far gone is this abscess. If it's a relatively mild abscess where it's just the beginning stages, the options are either to put the patient on an antibiotic and see how the antibiotic will treat and kill the bacteria so that their abscess can resolve, and then they can treat the tooth if the tooth is savable. If it's a relatively larger swelling, then sometimes a procedure called an incision and drainage may be necessary, where the gum next to the tooth is first anesthetized with numbing medication, and then a small cut is made in the gum to let some of the bacteria, some of the pus out and help relieve some of the patient's pain, and then decide what needs to be done with the tooth. If the abscess is even larger than that, then a decision might be made to remove the tooth, and that can be done sometimes in an office setting. But in severe cases where the infection is of a concern of traveling to other parts of your body, like your neck or your eye, then the patient might be asked to come to the hospital and have the procedure done under a more deeper type of anesthesia, where the abscess and the tooth can be removed and drained properly for the patient's safety.